Back speaking with Dr. Graham Kelly this morning from Filamon. Graham, morning.
Hi, Andrew.
Good to be catching up, Graham. Look, this is the second in a series of interviews covering Filamon's current drug development program. Today, we're looking at Filamon's new drug to treat the leading cause of blindness in the elderly. Just firstly, give us a bit of a recap.
Sure. Well, as was explained earlier, Philemon's focused on developing treatments for three of the most common chronic diseases of aging, and they're cancer, dementia, and macular degeneration of the eye. Now, today we're talking about macular degeneration, and that's becoming a major problem for our increasingly aging society, with 1 in 7 people over the age of 60 suffering from it and leading to blindness. And macular degeneration involves damage to that part of the retina that's responsible for central vision, which involves recognizing faces, reading print, newspapers, etc., watching TV, driving a car, and performing tasks that require fine detail. All of these things suffer in macular degeneration.
Well, tell us a bit more, Graham, about the macular degeneration program.
Right. Well, first of all, we need to understand that there's two major forms of macular degeneration. They're called dry and wet. And what we're talking about today is the wet form, because that involves blood vessels growing at the back of the eye that eventually became leaky, and they leak plasma into that retina, so that it actually becomes quite soggy, and that interferes with light getting to the back of the eye. And wet AMD is actually the major cause of blindness in older Australians. And worldwide, it's thought to affect about 20 million people. Now, it's becoming of growing concern to the Australian government because of the enormous costs around caring for older people who are losing their vision. There are drugs available, but they're actually limited in their action. About half of all patients with this disease get little or no benefit from current drugs. But perhaps just as importantly, these drugs are also very expensive, plus they need to be administered in a clinic. So you need to go to a hospital or to an ophthalmologist. Now, together, the cost of the drugs and the cost of the visits is costing the federal government several billions of dollars each year, and that's a problem that's growing. So that concern has led the government to join with the University of New South Wales in granting Filamon $4.8 million to develop beta-02 as what they believe, and we certainly believe, is a revolutionary treatment for this disease. And that 4.8 million is paying for the cost of bringing beta-02 into the clinic. Now, the project involves a total of 8 Australian scientists. They're assisted by overseas service contractors with their own teams of scientists. So it's a major project that Filamon is managing.
Well, tell us a bit more about the opportunity that you see for beta-02.
Yeah, well, we're excited because we see beta-02 fixing the two main problems associated with current drugs and this disease. The first problem is that current drugs are very limited in their benefit. They're very good at shutting down one of the two main drivers of the disease process, and that is the growth of these leaky blood vessels at the back of the eye. They're good at that. The problem is that there's a second driver of the disease, and that's a large number of genes that are creating the underlying inflammatory process in the first place and then keeping it progressing. And current drugs have no effect on this second disease driver. And with the result that at least half of all patients find current treatments ineffective at worst or disappointing at best. So beta-02 has been designed to shut down both of these drivers. And by doing that, that means that we can achieve a much stronger treatment effect. And we've confirmed this in animals where beta-02 outperforms the current market leading drug by 3 times, which is a very impressive outcome. So minimal effectiveness is the first problem that we believe that we've been able to address. The second problem is that current drugs need to be injected into the eyeball. They cannot cross the cornea as an eyedropper. They need to be injected. And that injection needs to be given every 4 to 6 weeks, and it needs to continue for the rest of a patient's life. And needless to say, this treatment is uncomfortable, it's inconvenient because you've got to go every month or so to a clinic. It's expensive, and it comes with a range of risks such as infection and bleeding into the eyeball. And of course, all that's on top of the treatment only slowing down the disease, not stopping it. So Filamon is developing beta-02 as an eyedropper that the patient can self-administer, and achieving that would be a major breakthrough development with this disease, saving the patient an awful lot of discomfort of the eye injection and the inconvenience factor of regular visits to a clinic. Put those two advantages together, and you have a potential revolutionary treatment. That's why we're excited.
Well, Graham, tell us a bit more as far as where you're up to in terms of development and what the news flow is looking like over the coming months.
Well, the program is making very pleasing progress. It's been going for just on 12 months now. Now, we've largely, in that time, completed all the basic chemistry work, and now we're at the point of preparing beta-02 as an eyedropper dosage form to get ready for human studies that we're planning for next year. Now, as you can see, I'm excited about the future of beta-02, and that excitement reflects what a team of university scientists who've been working on this opportunity for some 6 years have been able to achieve. Now, the next anticipated news we're looking at is proof of concept that the eyedropper form of beta-02 is working in animals, and we expect that in the next 3 to 4 months. And as always, Andrew, Filamon plans to keep shareholders on the market updated with news in a timely manner.
Well, looking forward to further updates in due course. Graham, good to see you. Thanks very much.
Thanks, Andrew.